It is such a pleasure. I am speaking with Dr. Suzette Oyeku. Thank you so much for being here. The purpose of this is just to say thank you so much for all the work that you've been doing, you and everyone at your hospital. I would love to know more about you. Shout out, you are also my fiance's sister. So this is extra special for me because I love you so much with my heart. You're a wonderful woman and a wonderful doctor. So
thank you so much, Amirah. It is really, really great to be with you and all of your fans. My name is Dr. Suzette Oyeku. I'm a general pediatrician, and I'm also the chief of the Division of Academic General Pediatrics at the Children's Hospital of Montefiore in New York. I'm also a professor of pediatrics at the Albert Einstein College of Medicine in the Bronx, New York.
I'm very proud. I'm a very proud sis. So great to have you. I had some questions from the fans. They wanted to know all kinds of things all across the board. So let's start reading off some of the questions from the fans.
Awesome.
Brittany, she runs one of my fan pages. Shout out to Brittany. Her question was, healthcare workers take care of us, but who takes care of them? It's a great question.
It's an excellent question. Thank you so much, Brittany. I think we have been fortunate. I think many of us are families. So Amirah, my brother, my husband, my dad, at least personally. But I think for many healthcare workers, it's really a village. It's our families. It's our colleagues. Like we call at CHAM, we call ourselves the Chamily, and because we're a family. And then I think also the broader community. We have been touched by just the outpouring of love and support from the broader community. So people have been donating food, they've been donating supplies, they've been donating chargers, and it has been amazing, the outpouring of love and support. I think the other place that a lot of us draw strength is whatever our faith is. And so for many of us, that is another place where we get restored and renewed during this time. So it's really a family affair.
Yeah, I remember we had our prayer session, right, Susie?
Yes,
we did.
And that's at the beginning. Yes.
No, yes. That's true. Look, that always helps me. It helps me find peace. And I know I definitely want to make sure we got a prayer session and to cover you, considering that you're on the front lines.
No, and I greatly appreciate it because that's the piece that draws strength. We're trying to take care of families, and we need to be strong, but being able to draw into our faith really allows us to be able to step up and do the work that we're called to do.
That's really great.
Yeah.
We have another question. Sophie in London, she asks if you have any tips for overcoming depression and sadness while in quarantine.
So I can speak to that personally. So I actually recovered from the COVID-19 infection. And so I was in quarantine for a little over 2 weeks. And my husband's mantra at the time was, help me help you, and stay in the room. So I remember that. And I think really the things to overcome during this time, and it's a myriad of things. So one, connecting with family. So definitely using technology and FaceTime or Zoom or Skype, that really helped to connect as well. Watching a lot of Netflix and TV, faith. And then for some folks, they may need to actually talk to a mental health provider. So depending, you're in the UK, I anticipate that there are some resource lines for you to be able to call to speak to a mental health provider. Many of them are doing video visits right now so that they can provide emotional support to people during this time, because many people are feeling depressed and isolated. So even though we're saying stay at home, does not mean that you are disconnected from the people that are in your life. So you still need to find ways to connect. And so we've encouraged people, make sure you call on family members, check in on the elderly, check in on people that you haven't spoken to in a while, because sometimes this season of being home can be very isolating for people if they're not interacting with other individuals.
We have Adrian wants to know, what advice would you give a teen wanting to work in pediatrics?
Well, pediatrics is the best field ever, and I'm biased. So I think for a teen who's interested, I think one of the things is to ask your pediatrician to see if you can shadow them. Because when you see them for your visit, you're only seeing a slice of what they do. And every pediatrician's life is a little different. I work in an academic medical center. So that means that in addition to seeing patients, I also teach, I also do research, and then I also do administration. Not everybody has that diversity in their schedule. Some people are primarily seeing patients as well, and then maybe teaching medical students or trainees. So the first thing is just to get to a shadow experience. And many hospitals actually have summer experiences. We don't know this year, given this pandemic, if likely those experiences will happen, but many places will have volunteer experiences for you to be able to get firsthand view. That's actually how I got into saying I want to be a pediatrician. I shadowed a pediatrician when I was in high school and then subsequently in college. And she became a lifelong mentor to Dr. Doris Weathers. And she was one of the first Black women pediatricians, was a full professor at Columbia. And for me, that was the person that I wanted to be. She, and I think it was great for me to have that visual because I was like, oh, I saw Dr. Weathers do it, and she went to medical school in the 50s. And if she did it, then I can definitely do it.
Surely you can do it. Oh my goodness. And how many young women now look at you and they're just like, oh my gosh, she looks like me. I could be a doctor. I could be a pediatrician. I'm so proud. Sorry. Okay, so we have Sue's question now. Sue says, how do you separate your emotions when you lose someone?
That is hard. I think, we're human. And I think when you're there in a professional capacity, you want to support the family and ensure in terms of getting them the assistance and support they need and to be there and acknowledging the death. And then I think it's also for us as providers to just be transparent as well. So I've lost some of my own patients and, I've called the family, I've gone to the children's funerals and followed up with the family afterwards. And I think it's important because it's not just taking care of the child when they're alive, it's also taking care of their family after the fact. And so I've found when I've been authentic and really reached out that they've appreciated that. And the family, the extended family has even appreciated that because this wasn't just my patient, this is somebody's child. There is an emotional, response. And I think our job is not necessarily to put that on for the family, but we deal with it. For me, it's really through my faith that I'm able to have peace about it. But I know that my biggest thing is being able to be available, be supportive, and then connecting family to resources and support that they need to be able to go through the difficult time of mourning the loss of a loved one.
One of my questions was, if someone were to get sick, what are the steps that you do? Because I know sometimes it's just so much word on the street right now, or word on the Instagram street or Twitter. It's like, do you stay home? Do you go to the hospital? So what are the steps once you start realizing, oh my goodness, I think I have something a little bit more than a sniffle?
So I think the first thing is figuring out your symptoms. So if you have fever, you want to try, if you feel warm, you want to see if you can take your temperature. What we're realizing now is a lot of people don't have thermometers at home. But if you can take your temperature, I would first say to call your doctor's office. Most of the doctor's offices they have staff either on the phone or they're doing televisits or video visits. And so they can do a check-in with you and get a sense of what your symptoms are going on. And then make a determination if you need to stay home, if you need to go to an urgent care center, or if they feel like you need to go to an emergency room. So your primary care doctor is probably your first place. If you don't have a primary care doctor, then you can call an urgent care center or an emergency room, and they can also discuss in terms of whether or not you should come in. But if you have primary care, that's probably the first place to go. If you don't have access to any of those things, you can also call the local Department of Health in your state, and they can also advise you. Many of the states have hotlines, and they can go over your symptoms and then give you guidance about whether or not you should be going where you should go. Definitely if you're having chest pain, shortness of breath, you feel like you're going to pass out, you need to call 911 and you need to go in emergently. But if you're not, where it doesn't feel it's a life-threatening emergency, then you can call any of those resources that I mentioned. I appreciate that you're providing this platform to be able to make sure that people know the latest updates, because the updates change every day.
Most of this was for the fans who may have a question or a need, you know, but for those who are financially stable and wanting to give, where would they be able to give?
Ways that people can give, definitely to Montefiore, is to our Children's Hospital, which is CHAM.org/ways to give. And then you can put donate, and you can earmark it to academic general pediatrics. You can also donate at Montefiore Giving, and that's a broader COVID relief fund, but it also, some funds can be used to help to support some of the research that's being done to identify treatments for novel coronavirus. So there are ways to be able to practically help families who are fighting and being impacted by this virus. And then there's ways to also advance the science so that we can have a better understanding of what we need to do should we have to deal with this virus again. Hopefully not.
Hopefully not.
Hopefully not.
Man, your lips to God's ears.
Yes, yes.
Well, sis, thank you so much. I feel like I'm supposed to call you in this forum, you know, Dr. Oyeku.
Thank you. Thank you. Thank you, Amirah.
Thank you for everything that you're doing. We just really are so grateful. We just realized, you know, this time has really, it's shone a light on really how invaluable so many of the frontline workers are. And so many people just kind of get ignored, from our bus drivers to the people that work at Rite Aid and Duane Reade, and, you know, and the restaurant delivery guys, and the cleaning crews. It really is, the beautiful part of this is that we really are all in this together. And so we're all really grateful for everything that you're doing. I love you so much.
Thank you. Love you too. Thank you so much.
Tonight, because guys, at the end of the day, doctors are human too.
Yes.
So we're going to release some of that energy to hopefully prep you up for another day's work tomorrow. And in any way that we can help, whether it's prayer, whether on Zoom, whether it's a dance party, whether it's I think you're right, whether it's a phone call, we're talking about everything other than what's happening in the world. I'm here for you, and I'm ready to go.
Thank you so much. Thank you so much. And I'd be remiss in not giving out a shout out to our pharmacist, because our other sister is a pharmacist, the other Dr. Oyeku in the family.
Yes, Dr. Claudette.
Dr. Claudette. And so they're definitely doing an amazing job on the other front line in terms of in our pharmacies. So just shout out to all the pharmacists out there.
Most definitely. Clearly, I make good decisions in my life with this family.
Thank you.
I love you.
Keep you healthy.
Yes, I know, right? And I'll keep you happy.
Yes, exactly.
I'll talk to you soon, sis.
Talk to you. Bye. Thank you.